Welcome to Amber Robinson and Paula Oliver from OhioKAN, Ohio Kinship and Adoption Navigators program. This presentation will give an overview of different public benefits for kinship caregivers in Ohio and some of the eligibility criteria. If you are a kinship caregiver and interested in learning more, feel free to reach out to OhioKAN. Thank you so much for this very informative and insightful presentation on public benefits.
So again, good evening, everyone. We are going to talk about some benefit programs. I saw some names in here that was really familiar. So if you've been here or joined us for one of these presentations, thank you for joining again. And if it's all new to you, hopefully you'll learn something that you didn't know before by the time this session is over. I'm Amber Robinson. I'm one of the benefit coordinators with OhioKAN. I've been with the organization, I want to say 3.5-ish, going on 4 years. Paula, go ahead, you can introduce yourself.
Hi, and I'm Paula Oliver. I've been with OhioKAN with 2 years on the 17th of this month.
Yep.
Yeah.
As Sydney mentioned, we're going to have a part in the presentation where I'll pause for questions. Again, like she said, you can put it in the chat or come off mute, and we'll spend a minute or two answering those questions, and then we'll resume and then have an opportunity at the end for more questions. All right, so what we'll cover today, we'll go over some information about kinship programs that are available in Ohio, as well as some benefits that can be accessed through Ohio Department of Job and Family Services, and a few others that are not necessarily accessed through them, but that could be beneficial to your family. And then like I said, we'll have time for questions in the middle and then at the end. All right. So I'm just going to dive in. The first program that I wanted to let you all know about, it's called the Kinship Support Program, or KSP. This program provides financial payments to eligible kinship caregivers for the placement of children in their homes. And so if you see here, we have eligibility. And so what that means for the purposes of KSP is anyone who's 18 or older and caring for a child in place of their biological parents. The kinship caregiver can be related to the child by blood, or non-relative. So for non-relative, it can be a neighbor or family friend. The child has to be in the custody of a children's service agency in order for you to be eligible for this. So that means if Johnny is if Johnny is taken away from his biological parents for a certain reason, Children's Services gets involved, they end up taking custody of that child, and then they call maybe Johnny's grandmother and says, hey, Johnny, was just taken from bio mom's house. We have custody. Is it okay if Johnny lives with you until things are getting figured out? And grandmother says yes. So what they would do is facilitate what's called a kinship placement to grandma, and they would complete what's called kinship home assessment. And there's some other things that they would need to do to verify. And once that is all verified, the caregiver would then be identified as a kinship placement. And then from there, that would start the process of that caregiver being awarded payment for being a kinship placement of their grandchild. As you see here, there's no income eligibility requirement. A lot of programs do require that, but this is one where they're not going to ask you how much do you make, how much do the children make. They don't consider any of that for eligibility for KSP, or the Kinship Support Program. And then as far as accessing it, so I said there's no application needed. This is kind of like an automatic thing once the process is initiated by Children's Services. And so payments, once things are approved, currently are $12.10 per day per child. So that amount can vary depending on how many children you have, right? And so the other piece of this is that you do get a payment and it's monthly, but the maximum amount of time you can receive it, is for 6 months, no longer than that. Or until one of the following occurs, which is down here. Say, for example, you end up becoming a certified foster caregiver to that child. then that 6-month payment through the KSP or kinship support payment would stop. Or of course, if the child is no longer living in your home, the payment would stop. Or if the program runs out of funds, the payment would stop. But typically a family, a caregiver can receive this up to 6 months. And I do want to note here, and I'll mention it later on again, with this program, say for example, the caregiver is caring for that child and they've gotten that 6-month payment and they're like, hey, child is still in my home, how am I going to continue to receive financial support for this kid? Job and Family Services, the Child Service Agency will send out a letter to the family ahead of time telling them, hey, you're coming up on your last payment. And they will recommend that the caregiver apply for child only cash assistance. Some people know it as TANF through Job and Family Services. It's not coming from the KSP program, but it is another way that a caregiver could continue to get financial support to use for that child. And we'll talk about that program more specifically as we continue. All right, so that was all with for KSP. Again, KSP is the one where only if the child is in custody of Children's Services and caregiver is caring for the child. But this one, Kinship Permanency Incentive, or KPIP, some people may call it that, or KPI, goes by a couple different acronyms. So this one is where a caregiver may be entitled to what's called incentive payments when they are caring for our kinship child. And so eligibility for kinship permanency incentive requires that the caregiver have legal custody or guardianship. We've had questions about this. It does not, if you have temporary custody, it doesn't qualify. If you have like a grandparent power of attorney, it doesn't qualify, or like a caretaker affidavit or emergency custody. Unfortunately, they want to see legal custody granted by the court or guardianship to qualify. For this one, again, caregiver can be related or not related to the child as long as they have either legal custody or guardianship. And so for this one, there is an income requirement. And so they are looking at income not going over 300% of the federal poverty guidelines. I thought I put that number in there for 2024, unless I have it in the other slide, I'll double check. But there is an income threshold that they look at for the family. I did kind of bold family because we've had questions about what does that look like for a household. So for the purposes of kinship permanency incentive, family is categorized as the kinship caregiver, their spouse, if that applies, and then the children in their care. We've had circumstances where that family unit was living with like maybe another family or like the grandparents or something. They would not include that separate family or grandparents. It's just the caregiver, their spouse, and the children in their care whose income they would look at, and it's gross. And I believe the numbers that they have is gross per year is what they want to see. And then here, as far as the process, so say if a caregiver meets this criteria and they want to apply, there is an application that they would have to complete in order to start the process. And then their county children's service agency facilitates a kinship home assessment as well as fingerprinting background check. Just to note here, with the fingerprinting background check, it's up to the county, so it's at their discretion whether they are going to pay for it or not. Most counties I've seen, they do pay for this, but there are a few that I've heard of where they don't cover the costs for the fingerprinting or background check. However, for most of the time, the Children's Service Agency should have an assessor complete that, and you shouldn't have to worry about paying for it. And then accessing the payment. So again, this would be meant for those families who have legal custody or guardianship. So once you get that from the court, you're good to go with starting the process to access that again, as long as your income eligible as well. And I kind of reiterate here, temporary custody order, et cetera, is not sufficient to meet that criteria for KPIP. And then you would submit your application to your local children's service agency. We do have it linked here So you can access it by clicking the link on the slide. You can always call your local children's service agency. Usually there's like a kinship department or a contact for KPIP that you can speak with to get that application. You would also submit verification of that legal custody or guardianship and verification of your income. So once everything's submitted, home assessment is approved, fingerprintings come back, and you're all good to go, then you'd be you'll receive the payment. So what that looks like is you would be eligible for up to 8 incentive payments. So the first incentive payment is the highest at $525 per child. You can use it for whatever you want. It's a check that you receive, and you can use that at your discretion. And so say you get that first $525 payment, the way this program works is in order to access the subsequent payments, you would have to, one, reapply, and you can only reapply at minimum 6 months from the time you got the first payment. So this is not a monthly payment. This is every 6 months at minimum, and you can do it up to 8 times. And then the other piece to this is that the subsequent payments after that first $525 per child goes down to $300 per child. So that's how that program works. Again, $300, you can as well use that at your discretion. All right, looks like that was all for the kinship permanency incentive program. And then remember, for the kinship permanency incentive, legal custody or guardianship, 8 incentive payments you can access at minimum every 6 months, as long as you are meeting all the other eligibility criteria. All right. So the next one, this is a newer program. It's called the Kinship Guardianship Assistance Program, or KGAP. As you notice, all of these programs have the word kinship in it, and a lot of them have like acronyms. They can get real confusing really fast. So the Kinship Guardianship Assistance Program, this one is newer. It provides financial payments to eligible caregivers who have been granted legal custody or guardianship of a child that was previously in the custody of Children's Services. So if you read that, you might think, hey, if it applies to you, I have legal custody or guardianship of a child that was in Children's Service custody. Am I eligible? We'll get into that. But this one does provide ongoing financial support. So ongoing means monthly support, typically until that child is 18 or 21, depending on circumstances. And then typically they would also be able to continue Medicaid up to that age as well, those ages. Okay, so for eligibility for this program, I just have some pieces here. Child needs to be a legal resident or citizen. They would have had to been removed voluntarily or by the court, and it was found that it was not in the best interest for the child to stay with their biological parents. The child would have to have a strong attachment to their kinship caregiver, and the child would have to be identified as a foster child by the Children's Service Agency, who would be holding custody of that child. I do have here, must be in the kinship caregiver's home as a foster child for at least 6 months. So I'll stop here because this is where it gets a little bit confusing. So basically for KGAP, I'm going to give another example of what it could look like. So say you have Johnny. He was removed from his biological parents by the court, found that it wasn't in the best interest to be living with mom and dad. Then the Children's Service Agency takes custody of the child. They then place the child with grandma, for example. Grandma is caring for Johnny. She's working with the children's services worker, the kinship worker, etc. After time goes by, grandma, maybe she's even getting KSP, right? That program we talked about, the first one, because she's, eligible for that one. Grandma's getting KSP. She then, maybe someone told her about KGAP and said, hey, maybe KGAP should be, is something that you might want to think about. Or maybe even her children's services worker told her about it because she's interested in getting legal custody of the child, right? So then what happens is grandma tells this worker that. The worker then supports grandma by assisting her with meeting the requirements to complete her foster care certification. So she goes through the classes. She completes it, she gets her foster care certification, right? So then once that happens, Johnny is then identified in children's services system as he went from a kinship placement to now a foster placement in grandma's house, right? And so once that happens and he's a foster placement in grandma's house, he would have to be that for 6 months, 6 months worth of time for grandma to then work towards, well, she would apply and then work towards obtaining legal custody of Johnny. Once legal custody is obtained, approved, granted by the court after that 6 months, grandma is then able to negotiate a monthly payment to use that, at her discretion for Johnny and Medicaid until Johnny is 18 or 21. I hope that makes sense. If you got questions, feel free to put it in the chat. The other piece here, reunification with bio parent and or adoption. So if the caregiver is thinking of adopting the child, would not be an option. So if any of these are an option based on the circumstances, then KGAP is not the option for that family. So if they're like, hey, it looks like the kid is probably going to be going back with mom, then it doesn't make sense for grandma to pursue KGAP. Or if grandma's like, hey, I really want to adopt him, then it doesn't make sense for her to pursue KGAP. And then here, guardianship or custody would have to be granted here. Noted that if the child is over 14, it's recommended that they be consulted about going into this agreement and just the circumstances for KGAP. And then just noting that a sibling of a child that is already getting KGAP is also eligible for KGAP.
And Amber, we have a question in the chat.
Oh, okay.
Does that replace OWF?
Does KGAP replace OWF?
Mm-hmm.
No. KGAP does not replace Ohio Works First child only payment. If a caregiver is a legal custodian or guardian of that child, they're also entitled to Ohio Works First. Alrighty. And then the caregiver requirements here, it's kind of similar to what I put for the child. So for the caregiver, so if we use that example for grandma, she would have to become a licensed foster caregiver, right? And certified by Children's Services. She would have had to cared for Johnny for at least 6 months. There needs to be a strong commitment to the Johnny. She must name a primary successor guardian. So in the event that she's no longer able to be his caregiver or a legal custodian or guardian, she would have to name who that would be. The KGAP agreement would have to be signed prior to grandma being granted custody or guardianship. So again, a lot of this though, you wouldn't be doing on your own because a child that would be eligible for this would be in the custody of Children's Services. So the caseworker, kinship worker would be working with that particular family on getting these things done. But an agreement would have to be signed before getting custody or guardianship. So remember when I mentioned that earlier, like, hey, if I have custody or guardianship of my grandson and they were in Children's Services before, well, unfortunately, this would have to be, you would only be eligible for this if this agreement was signed before you were granted custody or guardianship. So if you already have it, unfortunately, you wouldn't be eligible for KGAP. And then also, not only if you already have it, but also if the child is not in custody of Children's Services, they would be eligible as well. And then here, like, again, having that court order, and then can be outside of Ohio, as far as the individual. And then here, it's not, I mean, I don't want to get too deep in this, but just so you all know, there's two different types of KGAP. It's nothing that you would have to find out which one you would be eligible for. That's all up to the Children's Service Agency, but I thought it was great to know that there are a couple differences between the federal and state. With the federal, the child would have to be Title IV-E eligible, whereas with the state, they would not. With the federal, the child is categorically eligible for Medicaid, whereas for the state, the family has to apply for TANF child only and Medicaid through Job and Family Services. Federal, there is an annual redetermination, whereas with the state, it doesn't look like there is. Well, actually, no. Yeah, the Ohio Works First determination. Yeah, so basically for the cash assistance, yeah, just as OWF determination, I'm not 100% sure because I know for TANF child only, there's usually not a redetermination, but yeah. And then the state in both of these actually ends at 18 or 21. Okay. And then as far as payments, so I briefly mentioned that before. They say it's negotiated. It is, so it's not like the kinship permanency incentive where it's like, okay, you know you're gonna get 525 for the first one, the subsequent are 300. This one is a negotiated payment between you and job and family services. So there's no set amount that you're gonna get. What's gonna happen is that whatever you do get, it's going to be 80% of what you were getting when you were the child's foster caregiver. So when you become the child's foster caregiver, there's a certain amount that you're entitled to as their caregiver. So whatever the K-gap payment would be, it would be 80% of whatever that is. So it just depends. So we can't give you like a specific amount, but we do have an example here just to kind of understand that 80% of whatever that is. Also, there's no income test. So that just means it's not like they're going to say, how much do you make to determine what that monthly payment, K-gap payment would be. They do consider the child's SSI if they are on SSI. And I want to say with that, it just means that the payment may be negotiated as higher, just noting maybe the child has more needs. So here is an example of that 80% piece there. All right, I'm going to pause here for questions.
We have one in the chat.
Yes.
So if you already had legal custody, then you would not be eligible for K-gap. Is that correct?
If you already have legal custody or guardianship of a child, you would not be eligible for K-gap. K-gap is, and with our work with families, what we've noticed, unfortunately, families sometimes weren't told that by children's services. Like even if the child was involved with children's services and they had custody, families miss that window because then the children's service agency encourages them to get custody and it eliminates their eligibility for K-gap. So there's like a sweet spot, a window of time where a caregiver is eligible. And if that time is missed, then they can't, they're not eligible for it. All right, I'm going to go ahead on to the next section. So what I'm going to do now is start talking about benefits that can be accessed through Ohio Department of Job and Family Services and some others. And then any questions I didn't cover, we'll do it at the end. Thank you all for your questions though. All right, so this is the one I was mentioning for, I forget, I didn't catch your name, who had mentioned something prior as far as what you may be eligible for. So this one is called Ohio Works First. It's the actual name that is given to Ohio's cash assistance program. People call it TANF. Ohio Works First is, again, the financial assistance portion of the state's TANF, stands for Temporary Assistance for Needy Families program. The one I'm going to really focus on tonight is the child only version, okay? Because that's the one where, you know, your kids are going to be eligible for. So for the eligibility piece for Ohio Works First, when we're looking at that for child only, they're looking at what a specified relative is. For the purposes of Ohio Works First child only, a specified relative is anyone who's 18 or older, related to the child by blood or adoption. And so when I say adoption, it wouldn't be, hey, I adopted my my grandchild. If you adopt your grandchild, the way they look at it, that's your child. When we say related by adoption, it's, let's say if, I always get stumped, I'm trying to give an example. Okay, say Johnny was adopted by his mom, you know, Johnny's mom adopted him, right? And certain circumstances occurred where Johnny's mom's no longer able to care for him, and he goes and lives with grandma, who is technically his adopted grandma, and she's caring for him as a kinship situation. Adopted grandma can go apply for Ohio Works First, right? But if adopted grandma adopted Johnny, then she would not be eligible for Ohio Works First child only. I hope that makes sense. In addition to that, a person can have legal custody or guardianship, but it's not required to have that. And again, they would have to be caring for the child in place of the child's parents. Note here that it does not say non-relative, so that's where it can get tricky. If a person is caring for a child that they're not related to by blood or adoption, they're going to have some type of legal custody or guardianship to be eligible for Ohio Works First Child only. And so we have some examples here as far as relation. There is an income threshold for this program. It's really, really low at 50% of the federal poverty guideline. I want to say for one child, it's like $600 and something max gross. And as you heard, I said child. So for this program, they are not going to look at your income. So any adults in the home, they only look at the income of the child or the assistance group, which means the group of children. So if you're caring for 2 grandchildren, they're going to say, how much do those 2 grandchildren make? A lot of times kids are not getting any income, but sometimes they may be getting like an SSI check if they have a disability, or if we've seen like if a child's biological parent or parents passed away and that parent paid into Social Security or SSDI, and the child can pull from that parent's benefit that they paid into over time. So they would look at stuff like that as like the child's income and determine whether that exceeds that 50%. Most of the time we see kids are eligible because they're not getting income. If they are, it doesn't automatically mean that they won't be eligible for the child only Ohio Works First. They just need to know how much it is, if it's over or not. This I'm just going to go pretty quickly through. It just kind of outlines most of the things that I mentioned on the previous slide. Again, if you look over here for the child only, it goes over again some more of the eligibility piece, just kind of highlighting that the caregiver's income should not be considered if you apply for this, and Job and Family Services is like denying you because they took into consideration your income. That's an issue. You're going to have to appeal it or reach out to us at OhioKAN and we can support you in getting that fixed. And then here, I think it's important to note amount of assistance. So the actual amount that a person would be eligible for depends on 1, how many kids are in the household, 2, how much money they're receiving. So the amount increases the more children are in that assistance group. Okay, and so accessing it, you would have to apply for this program through your local Job and Family Service agency. You could do it a couple of ways through the Ohio Benefits portal. If you have the ability and access to do so, it's quicker to do it that way. You keep all your information in this portal. You can get updates, submit documents through there. So you could do it that way, or you could just complete the paper application and submit it to Job and Family Services or call their number to apply it over the phone. And then just reiterating here, the amount that one would get depends on how many kids in the home and then how much they're getting. And then this is a monthly payment that you would get on behalf of the child until they are, I believe for this one, it's 18 or 19 if they're still in school. And then if they're no longer in the household, they wouldn't get it too. And then once approved, you would get the monthly payment on a debit card. It's called Way to Go. They just recently updated the issuer. And you just use it like, you know, as any debit card, you can use it for whatever you need it for your household. And it does roll over. It's not like you have to spend it, you know, by the end of the month and then you lose it or anything like that. Okay, so that was Ohio Works First. Again, a lot of times in our work, we see most of our families are eligible for this. This is the one where, especially if families are being told that they're over income for a lot of stuff, this is the one where at least they should be able to access as long as they're meeting that specified relative eligibility piece. Okay, and so this is SNAP, or the Supplemental Nutrition Assistance Program. This one provides nutrition benefits to supplement food budgets of families so they can purchase food. Eligibility for this one is in Ohio is being an Ohio resident, but this is a federal program. It's everywhere. But for Ohio, be an Ohio resident, you would have to meet income, expenses, and resource requirements. And then they just sent an update out about this. We're still getting more clarity on how it actually works, but they sent an update that they're doing a tiered or sliding scale for SNAP now. So it's the sliding scale goes up to 200% now of the federal poverty guideline. So that's something where we've been encouraging our navigators to tell families about, because those that may have had their benefits stopped because they went over the previous cap may actually be eligible to continue their benefit. And then accessing SNAP, similar to the Ohio Works First or Child Only, you would apply through the benefits portal, the paper application, or calling. The amount that the family would receive depends on the household. So there's, similar to Ohio Works First, there's a chart that tells you, how much you would get based on how many people are in the household. For this one, it is based on household, not child only, not adult only. We've had that question like, hey, can I apply for SNAP just for the kids? Unfortunately, no, they do consider the household income. So everybody that lives in there, they want to know how much you make gross per month. And then once approved, the benefit would be issued on what's called an electronic benefits transfer, or EBT card. Again, similar to Ohio Works First, it can be used like a debit card to purchase your food at mostly almost all grocery stores. And then here, just kind of noting, and this is not just with SNAP, but with most benefit programs through Job and Family Services, they'll send you a correspondence like through a letter or through the benefits portal when it comes time for you to recertify the benefit. So that means that there comes a time where they'll ask you to verify if certain information is still correct, usually the income, because they want to make sure that you are still income eligible. And you would have to make sure you do that in the time that they give you so that your benefit doesn't lapse. So the next one that can be accessed through Job and Family Services is Medicaid, which is a state and federally funded healthcare plan that provides medical insurance to people who have lower incomes and who are medically vulnerable. And Medicaid, like most insurance plans, it covers pretty much everything: doctor's visits, dental, vision, medication, emergency services, family planning, behavioral health care. They even help with like transportation to and from appointments. We had United Healthcare come in and do a presentation. Their managed care plan even helps with like cell phones. So they do a lot of cool things. Case management. And then eligibility, individuals, families, infants and children, pregnant and disabled persons. Do want to note here that eligibility, in addition to what I mentioned, would need to be a U.S. citizen or meet Medicaid citizenship requirements, have or be in the process of getting a Social Security number, resident of Ohio for Ohio Medicaid. And then here there are some financial requirements, again, that you would need to meet. There's not one set federal poverty guideline to qualify. It depends on the group. So for example, here for individual, I can't remember what it is off the top of my head, but say for an individual, the income threshold is 10%. Families is 20, infants and children, 25, etc. So it just depends on the group that one would be identified in, and they would determine what your gross monthly income cap can be to qualify. And then qualifying time period pretty much is every 12 months they review eligibility for Medicaid. We just noted here that anytime families that experience a change affecting their eligibility within that 12-month period has to let their Job and Family Services agency know within 10 days or so of that change. And this is not just for Medicaid. This is what we talked about for SNAP, as well as TANF, child only, like if the child's income changes. Because we don't want you to be like slapped with like an overpayment, like notice or something like that, or for that benefit to like abruptly stop and you're not expecting. So pretty much just in general, we encourage families to just keep them updated with any changes that happen. And then when and how to access it. So after the application is approved, you'll be able to get your Medicaid, again, noting applying through Job and Family Services or the Ohio Benefits Portal in person or by mail or on the phone. Do note here, we have the Medicaid Consumer Hotline for other Medicaid questions. And I do want to kind of put like a thing here. Open enrollment for Medicaid is coming up starting November 1st through the 30th. So that is a time where if you are currently on Medicaid, I mean, folks can enroll at any time, but if you're currently on Medicaid and you are like wanting to change your managed care plan. So examples of that could be like CareSource, or I mentioned United Healthcare. I think they have like Molina. You can change it at that time. Sometimes we'll have families where it's like they'll apply for Medicaid through Job and Family, and they'll just give them like a managed care plan, or maybe the family missed the time to select one and they have CareSource, but maybe their providers in their area don't accept that managed care plan of CareSource. Excuse me, they may accept like Molina. And so that family, that's a great opportunity for them to switch it to whatever, is accepted or, used a lot in their specific area. Or maybe if they're just not happy with that managed care plan in general, or it's not meeting the needs that they have, medical needs that they have, they can change it during that time too. All right, childcare. So this is like top of our list as far as one of the needs. And we just know how childcare really, like, it's difficult to find it and access it in general, just federally. So childcare options in Ohio, or through Job and Family Services that we wanted to talk about was the publicly funded childcare. So this is one that can help families pay for or pay a portion of childcare costs. The family would have to be working in school or some type of job training. We've had families ask, if they can be eligible if they're not meeting that criteria. Unfortunately, no. Working, you would have to be at least part-time. I believe the same for school. The gross income, again, past 30 days, we have it can't exceed 142 to 200. And I have in parentheses child care choice voucher. So that choice voucher is a newer program, similar to what I just mentioned for SNAP. It's like they're doing like a tiered thing where if your income is over the 142, you could potentially still be eligible to receive assistance with paying for childcare through this choice voucher program. And the way that works, so say, for example, you're like, hey, my income is over the 142. How do I access the child care choice voucher? Well, the way it works is you still would need to go and apply for the publicly funded child care through Job and Family Services, get denied, and then once you're denied, they would let you know as far as your eligibility for the child care choice voucher program. And then eligibility as well is the child can be up to 13 years of age or 18 if they have a disability. And then just noting again how you can apply. Redeterminations are every 12 months for childcare. Also, it's good to know too when you're applying for this, it's helpful to maybe have a couple of childcare options in mind when you're completing that application. The other that I have here is Head Start, Early Head Start. So this program is for children prenatal to age 5, provides services to children and families in various areas. It includes preschool programs that serve children 3 to 5 years old. They also serve infants, toddlers, and other things for like pregnant individuals. Just note before I get into this, Head Start, Early Head Start for kinship children is free. As long as the child is a kinship child, you can prove that they are categorically eligible for Head Start or Early Head Start. They're not going to look at income to determine eligibility. So I do have here, it's generally based on family income, but again, kind of put that here that, they're eligible for that without the income piece being considered. And then to apply for this, we encourage you to just contact your local Head Start program in your area. We do have a link here to locate that for you. All right, the next program is WIC, or Women, Infants, and Children. This is another kind of like food program that provides specific things for women, infants, and children. They have other programs within the WIC as well. But it can help things with like eggs, milk, cereal, fruits, vegetables, etc. And so with WIC, folks that are eligible are pregnant individuals. They could be breastfeeding. Individuals who just had a baby may be eligible, and then infants birth to 12 months, and then children up to 5 years old. So if you're caring for, a small child in your home, your family may be eligible for support through WIC. Eligibility, you have to be a resident of Ohio. You do have to be present at the clinic and provide proof of identity when you go. So it's not just completing and submitting an application. There's another step to it. You do have to locate your local WIC office and go to, like, physically go there to complete the application process. And there's some other qualifications or some eligibility pieces that need to be determined, and as well as income as well for WIC. And it's at 185% of the federal poverty guideline. All right. And then qualifying time period, short-term program, one can graduate from that program once the certification period ends, and that's dependent on that certification period is the length of time a person is eligible for benefits. And it depends on basically what the circumstances is. But usually people can get it for up to 6 months to a year at a time. And then once that end of time has that time period ended, you can apply again if you still need it. And note here, you can use you can have WIC and also have SNAP. It's not that you can do one or the other. You can have both at the same time. Accessing it, pretty much just wanted to note here, just again, completing that application, also visiting that WIC clinic to complete the process. We do have the phone number here if you need help with locating a WIC clinic by contacting Help Me Grow. There is a printable application on the Ohio WIC website. You can mail it into the WIC clinic in your area. And like I said, noting that you have to schedule an appointment after you do that. All right. The other program I felt was important to let you all know about is PRC, or Prevention, Retention, and Contingency. This one provides benefits and services for families who are having some immediate barriers and need some support to kind of get back on track. So basically, PRC programs are governed on the county level through Job and Family Services. With that, it varies on the services and supports that they offer and some of the eligibility pieces. But just going to go through some eligibility just a little bit here. They serve families, minor children living with parents or specified relatives, pregnant individuals and teens, and non-custodial parents who live in Ohio but don't reside with the children. The highest income eligibility that I have seen throughout some of the PRC plans in various counties is 200%, but based on the program specifically, it could be higher or a little bit lower. And some services that they can help with is if you're facing any need with rent, mortgage, property taxes, home repairs, utilities is a big one, transportation services. I've seen some plans they can help with like a bus pass or paying for car repairs or car payments. If you experience a disaster, house fire or flood, they can help with assistance with that. Workforce supports. So if you're starting a job or have a job and you need help with buying things for your job, they can help with that. Family support and stabilization services. I've seen a lot of them have school supply. They can help with purchasing school supplies and clothes. Youth development and intervention programs. Tutoring is a good one. And then community awareness and outreach. So early childhood development and learning initiatives. It can vary on what those initiatives and programs are specifically to the county. This one, I noted here, but this is no longer in existence. In Ohio, it was a program, but it's no longer. I guess I had to take that one out. But yeah, Kinship Caregiver Program is one that they used to help out with. And again, just note that these vary a lot between counties. So it's based on community needs. So it's good to go to your local Job and Family Services website and search their PRC, or Prevention, Retention, and Contingency section of their website to see all of what they offer and eligibility. And some of them have like an application online you can apply. Some you may have to call. Most help in some way with rent or mortgage and utilities for sure. The rest, it just depends. And I will note here, what I have seen for rent, mortgage, and utilities is that a lot of them want you to either have a disconnection notice or eviction notice or be like behind by so many days in order to qualify. For the car piece, I've seen like for repairs, they want you to first get like 2 estimates somewhere before they'll step in and potentially, help. Also, for some of this, they want you to be like working to qualify. And then when and how to access at any time that need comes up, you can contact your local Job and Family Services, particularly to access this PRC service. We have the county directory here to locate that. I think this is the last program I wanted to cover. SSI, Supplemental Security Income. This is a federal program that is funded by general tax revenue, not Social Security taxes. People kind of interchange SSI or SSDI. And so just to clarify, SSI or supplemental security income is based on financial need and disability, whereas SSDI is based on disability, but also what an individual has like paid into it after like working over years, and they take it out of your check and you see that in there. That's what SSDI is. So for children, most of the time based on their disability, they're getting SSI. Oh, and then it provides a monthly financial payment to that child that has a disability or blindness. And then again, having that income and resource below certain financial criteria as well. So eligibility for SSI, the child must either be blind or disabled. The child may be eligible for SSI beginning as early as the date of birth. Because there's no minimum age requirement. It's not like, oh, you have to wait until they're this age to apply and qualify for SSI. The child may be eligible for benefits until age 18. After 18, if they're still identified to have a disability as identified by the Social Security Administration, they would have to reapply in order to meet, and then have to also meet criteria for disability for an adult, which is a little bit different. When they turn 18, like as noted here, they evaluate that individuals. When the child turns 18, they reevaluate to determine if they meet criteria for adult. As I mentioned, kids with visual impairments may be eligible based on their blindness if it meets definition, which I do have the definitions here that you can take a look at. Deeming income, basically they look at pieces of the family's income to determine income eligibility, not all of it, but they do look at some income and resources to determine that part. Also the disability piece, the child must have a medical condition or combinations of conditions that result, and I have it bolded here, marked and severe functional limitations. So it means that the condition or conditions must very seriously limit the child's activities. And again, that's all up to Social Security Administration to determine whether their diagnosis meets that criteria. Also has to be, the condition must have been disabling or be expected to be disabling for at least 12 months or expected to result in death. Again, we recommend that families just provide as much information that you have that speaks to the child's disability, because it just depends on the people that are evaluating it at the Social Security Administration that's going to determine whether they meet that criteria. But we always recommend anything from the school, anything from the provider or the medical professional that's treating them, like provide as much information as you can that speaks to that disability. When and how to access it, again, as it mentioned, beginning as early as birth, if they have, if a disability happens at that moment, at that time or whenever it occurs and they've been treated and diagnosed. There's a child disability report that would need to be completed first before the official application is completed. That disability report is basically the time for you to give detail to the child's disability. So I mentioned they ask about information about their school, if they have a therapist or doctors, who they see, how often they see, what have they been diagnosed with? Are they on medications? If so, what medications? There's also the opportunity to, if you don't have that information or records, you'll sign off on something to give Social Security Administration the permission to pull that on your behalf to review. Once you complete that, they will reach out to you in a certain amount of time to get any more information if needed, and then actually go through the application. We have some information here on how you can do that. If you can't start the disability report online, you can contact them. And then amount, we just have the maximum monthly amount for 2024 listed. But that it could, it depends on the income piece as well. So 943 in 2024. If approved or denied, you will get a letter. For children, typically it takes it's less time if they're gonna come back with a decision than adults. A lot of times with adults, we see they're denied, and they have to appeal. But it all depends on the situation and circumstance. But a lot of times it doesn't take as long for a child to hear back compared to an adult. And then after the child gets it, they do reviews of the child's medical condition to verify that that condition still exists and that it's still meeting that definition of disability for a child. All right, Paul, I'll pass it off to you.
All righty. This concludes our presentation, and if you want to connect with OhioKAN, we have provided the information, the contact information. There's the phone number. Our services are 100% free for Ohio's kinship and adoptive families. And if you do connect with us, you will speak with a navigator. That would be your first point of contact. And the navigator will talk to you one-on-one and go over benefit programs with you and any questions that you may have. And so OhioKAN is available Monday through Friday, 8:30 a.m. to 6:30 p.m. And again, if you connect with us and you meet with a navigator, and then if the navigator will go answer any questions, go over benefits. If you come across a question that the navigator may not be able to answer, then they refer families to Amber and myself. And then we'll help navigate that gap or barrier that you may be experiencing accessing those benefits.